Hello everyone and welcome to my channel. Here in this video we are going to study the fracture of midface, and in fracture of midface we are going to deal with Lee-Fort 3 fracture, also known as the transverse or suprazygomatic fracture. See, the name itself clarifies the fracture, that suprazygomatic fracture means the fracture is above the level of the zygoma. Here we have the zygomatic protuberance. You can feel on both the side using your finger, and the fracture level is above this, and that is the reason it is also known as the high level fracture. See here, the line of fracture extends above the zygomatic bone on both the side as a result of trauma. Okay, and force is usually applied from the lateral direction, and there is a severe impact. The force, this is very important word, there should be severe impact to cause this fracture to occur. Okay, here the initial impact is taken by zygomatic bone, resulting in depressed fracture. Please pay attention. When there is an initial impact here, okay, it caused the depression of this side of the zygomatic bone, and the contralateral side of the face, on the contralateral side here, on this side the zygomatic bone will be displaced laterally. Okay, and you can see here on which bone is acting as a hinge. It is like this. Let me show you. This is the mid face here, like this. This is my right side of the zygomatic bone, and this is the left side of the zygomatic bone. If force is applied here like this, the bone rotates like this and it causes crushing of, here we have the ethmoid bone. What is this? This is the ethmoid bone. Okay, when force is applied, it rotates or hinge around about the fragile ethmoid bone. This is the ethmoid bone, and whole bone rotates like this, and this cause crushing of the ethmoid bone. Okay, what happens here? Please let me explain you once again. See, whenever the force is applied from this side of the zygoma is depressed inside, and this side of zygoma is displaced laterally, and this whole process cause the comminution of the bone which is present at the center and forming the base of the skull, that is ethmoid bone. Okay, so what does the word comminution means? Comminution means the ethmoid bone is fragmented into many parts. Let me explain you the proper fracture line of the Lee-Fort 3 fracture here on the in this diagram. Okay, see here. Here we have the skull, and here the mandible has been removed. Please see here. Can you see the fracture line? See, in a typical high level Lee-Fort 3 fracture, the line commences or starts near the frontonasal suture, which causes dislocation of the nasal bone. See, due to this fracture, the nasal bone is dislocated, and disruption of cribriform plate of the ethmoid bone. We have studied, I have explained you how there is a hinge about occurs in the ethmoid bone, and due to that there is a disruption of the cribriform plate. Let me show you. Here the fracture line starts, and see how it passes through the frontal process of the maxilla, and then it passes through the lacrimal bone, the upper end of the lacrimal bone, and enters the ethmoid bone. And see here we can see the fragmentation of the ethmoid bone. Can you see the fragmentation of the ethmoid bone or comminution of the ethmoid bone? Why it has occurred? Because of the hinge movement which has occurred about this ethmoid bone. Okay, see here. Now here we have the optic foramen. What we have? Optic foramen. and which is surrounded by dense ring of bone. Yes, optic foramen is surrounded by dense ring of bone. But before dealing with the optic foramen, let me explain you what is the impact of the disruption of the cribriform plate, which is part of the ethmoid bone or the perforated part of the ethmoid bone. Okay, since it is disrupted, so the dura mater, which is the covering of the brain, that is also disrupted, and when that is also damaged or disrupted, the cerebrospinal fluid which is circulating inside comes out from the nose, and that is known as CSF rhinorrhea. When that liquid comes out through the nose, that is known as CSF rhinorrhea, and this is seen in Lefort 3 fracture when the ethmoid bone has been disrupted. Okay, in such cases the line of fracture crosses both nasal bone and the frontal process of maxilla, as you can see on the in the picture. Okay, near the frontonasal and frontomaxillary suture and traverses upper limit of the lacrimal bone. Please see here, it is traversing the upper limit of the lacrimal bone. Am I clear? Yeah. In such cases, the line of fracture is crossing here. Now, when you continue it posteriorly, more posteriorly, it will reach the optic foramen, and this optic foramen is surrounded by a dense ring of bone. Yes, optic foramen has the dense ring of bone, and this fracture won't be able to crack or break this optic foramen into two parts because there is a thick deposition of bone here. So what will happen? From here the fracture line will be deflected downward. Please pay attention. Can you see the fracture line gets deflected? Yes. Deflected downward and laterally like this. Okay. This is the fracture line which has been deflected downward and laterally. Now let me show you here. And see, the fracture line has reached the inferior orbital fissure. Fracture line has reached inferior orbital fissure. Okay, and here can you see the inferior orbital fissure? This is the inferior orbital fissure, and it has two aspects. This one is the medial aspect and this one is the lateral aspect, and the fracture line has reached the medial aspect of the medial aspect of the posterior limit of the inferior orbital fissure. This is the posterior part and this is the anterior part, and on the posterior part this fracture line has reached the medial aspect. Okay, and from this point the fracture descends across the upper posterior aspect of the maxilla. Let me show you how. Here we will see the fracture line on the other side also, contralateral side also. Here also the same way, there will be the comminution of the ethmoid bone which will cause CSF rhinorrhea, and there the fracture line will be deflected downward and reach the medial aspect of the lower inferior orbital fissure on the posterior side. Okay, now we will remove the zygomatic bone and look how the fracture is going downward and damaging the maxillary bone. Please see here, this is the upper posterior aspect of the maxilla. This is also the upper part, this is the lower part, and this is the upper and the posterior aspect of maxilla. Okay, in this region we have the sphenopalatine fossa. When we will remove the maxillary bone, we can see the palatine bone inside, and the palatine bone and the sphenoid bone is forming a fossa like this, and that is known as the sphenopalatine fossa. Let me show you. Can you see here? This is part of the sphenopalatine fossa. Okay, region of spheno, because on the back side we have the sphenoid bone, and the anterior side or front side we have the palatine bone, and the fossa or the depression formed is known as sphenopalatine fossa. And here we have the upper limit of the Terigo maxillary fissure. Let me explain you what is Terigo maxillary fissure. Here you can clearly see the pterygoid plate, okay, and here this is maxilla, and the fissure which is present between the pterygoid plate and maxilla is known as Terigo maxillary fissure. And through these line, through these fossa and fissure, this fracture line will pass and break this pterygoid plate from its base. Let me show you. See where the fracture line has reached. The base of pterygoid lamina. The pterygoid lamina at its base is fractured. Okay, the pterygoid lamina at its base is fractured. Here it is fractured. Okay, so can you see how from inside the fracture line is traversing or traveling and damaging the parts? Okay, so now the maxilla has been totally dislodged from the cranium. Okay, but still maxilla can't be removed out, can't be it cannot be mobile here. Why? Because the zygomatic bone, although we have removed zygomatic bone, but still the zygomatic bone is here, which is holding this maxilla like this. Zygomatic bone is holding this maxilla like this, and it's not allowing the dislocation of the maxilla till now. So what will happen now? We have to break the zygomatic bone also, because there is only the fracture has been only in the interior part. Now we have to look, or we have to study the fracture, how it is damaging the external part, the zygomatic bone, so that whole this part can be mobile. Okay, let me show you. Here we have removed the the maxilla part. Can you see the palatine bone here? This is the palatine bone. And can you see the depression here? This is known as spheno. This is sphenoid bone and this is palatine bone, and here this depression is known as sphenopalatine fossa. Am I clear? This region is known as sphenopalatine fossa. Okay, and see how the fracture line is traversing and damaging the base of the pterygoid plate, and this is the palatine bone. Here we have the sphenoid bone, and what part? This is the pterygoid plate part of the sphenoid bone. Okay, this is the pterygoid plate part of the sphenoid bone. Sphenoid bone is also present at the base of the cranium. It is also forming the cranium, one of the 8 bone which is forming the brain box, that is cranium. And what we have to do in this fracture? We have to dislodge the facial, the mid face from the cranium. Okay, now see here on the, we have studied the how the fracture line is passing towards inside. Okay, now we will see how the fracture line is passing on the outer side, and see this whole mid face can be dislodged only if there is the dislodgement, or there is a fracture on both inside as well as outside. Then only whole this mid face, mid part can be removed out. Okay, see here, please look here. Here, this is the inferior orbital fissure. Inferior orbital fissure is the natural line of weakness. Okay, since already fissure is present, so and here you have the suture, and this is the greater wing of sphenoid, and here on this side we have the zygomatic bone. Okay, this is the greater wing of sphenoid, and here we have the zygomatic bone. And now the fracture line will pass on the lateral surface of the orbit. This side is the lateral surface of orbit, and the line of fracture will pass adjacent to this suture. Here we have the suture, and the line of fracture will pass adjacent to this suture and will break this part which is adjacent to the frontozygomatic suture. Please see here how the fracture line passes. Okay, can you see the fracture line is passing, which is from the lateral aspect of the anterior part of the inferior orbital fissure, and it is breaking the zygomatic bone like this, and it is moving abruptly downward through the infratemporal surface. See, we have the infratemporal fossa here, and this part is the infratemporal surface, and this fracture line is moving through the infratemporal surface and is breaking the or meeting the line of fracture from inside. See, we have two line of fracture. One is from inside here and again from outside here. Both the line will meet and this whole structure will be dislodged or can be dislodged after the fracture. Okay. Now I will explain you once again how the fracture is occurring here. Okay. So now we will just revise, sum up all the lines or the fracture lines here. See here, the fracture line starts near the frontonasal suture. Can you see here the fracture line here, which is near the frontonasal suture, and it is the fracture line passes through the frontal process of the maxillary bone. Please see here, the frontal process of the maxillary bone has been broken due to this fracture line. Now the fracture line passes to the lacrimal bone here, and then it has done the comminution of the ethmoid bone, multiple fracture of the ethmoid bone, and when it passes towards this part, that is optical foramen, when it is traversing more posteriorly, it gets deflected downward and laterally. Why? Because of the deposition of thick bone around the optical foramen. Okay, now see here how the fracture line is passing downward. Can you see the fracture lines here? This is the how the fracture line has been passed. Now the fracture line has been passing laterally and downward, and it is meeting with the medial aspect on the posterior part of the inferior orbital fissure. Okay, inferior orbital fissure on the medial aspect. Now we have removed the zygomatic bone in order to see the fractures, the inner side of the fracture, the inner fracture. See here how it is deflected towards inside, and see, although I am showing this fracture on the outer side, but actually what happens, this fracture is occurring on the inner plate. We have two plates. Okay, so this fracture is occurring on the inner plate, which due to the fracture line which is towards the inner side of the skull. Now we have the separation of the plates, pterygoid plate. See here. Now from here, on the anterior and lateral portion of the infraorbital fissure, the fracture line will traverse or travel outward like this, which is adjacent to which suture? The sphenoid bone and the zygomatic bone. Here we have the sphenozygomatic suture, and which part of the sphenoid bone is this? The greater wing of the sphenoid bone is this. And see how it is passing here from here, and here there will be the break in the zygomatic process like this. Please see here. Can you see the break in the zygomatic process? Here the zygomatic process has been broken down. And can you see the line of fracture is like this something? And this is above the level of the zygomatic bone, and this is transverse fracture, and this is dislodging whole midface region, and it is here the whole midface has been separated or detached from the dense cranial base. Here we have the cranial base, and here the whole midface region had been detached from the cranial base. Okay, and what happens since this part has been detached? So what happens, the muscles are pulling it inside, and due to that, since muscle is pulling towards inside, it causes the open bite here. Okay, and the teeth are touching towards inside. Actually what happens, there is a tilting. See what happens, this part has been broken, this part had been detached. So what happens, due to pulling force of the muscle, since muscle is pulling it like this, so what happens, this plane is shifted like this, this plane is shifted like this, and since this plane is shifted like this, so what happens, this occlusal, the both the molar touches each other, and here on the anterior side we can see the open bite. Why? Because the muscle which is present here has been applying the pulling force over the maxilla. Okay, so here we studied about the line of fracture in Lee-Ford fracture. Okay, so that's all for this lecture and video. If you like the lecture, please like and subscribe the channel, and whatever your demand will be or whatever your suggestion, you can write in the comment section. Thank you so much.